Welcome to our project where we discuss about the US and Canada's healthcare and diagnosis, treatment, death rate, prevalence, costs, and healthcare provided for heart failure. First, we'll take a look at the US. Heart failure occurs when the heart fails to pump enough blood to the body. It is associated with shortness of breath, persistent coughing, increased heart rate. The test to determine heart failure is measuring ejection fraction using echocardiogram. Normal ejection fraction is 55 to 70%, whereas under 40% indicate heart failure.
Moving on, according to a study from 2014 to 2019 in the United States, there's an estimated number of about 6 million Americans that have heart failure. There's been an average hospitalization rate of about 750,000 Americans per year. The average death rate is estimated to be about 3.2% for every 1,000 people. The usual drug treatment plan for people with heart failure has been either ACE or ARBs, mineralocorticoid receptor antagonists, SGLT2 receptor antagonists, or beta blockers.
So now let's look at the care and the cost. So currently, the readmissions rate for heart failure patients is 21% in 30 days. Patients on average spend anywhere from $20,000 to $30,000 per year on treatment. This cost varies greatly due to insurance that is available to Americans. Care usually involves being directed to a specialized heart failure clinic where a team of cardiologists and other specialists provide both inpatient care and outpatient support. According to the American Board of Internal Medicine, there are over 1,000 certified advanced heart failure specialists in North America. And of these, only 17 are not located in the United States.
So in Canada, the definitive test to diagnose a patient with heart failure is an echocardiograph. After that, the ejection fraction is measured, and for most patients with heart failure, the ejection fraction is less than or equal to 40%. Treatment of that ejection fraction involve a combination of medications, including an angiotensin receptor, an neprilysin inhibitor, a beta blocker, a diuretic, and a sodium glucose transporter 2 inhibitor. We also saw that in 2018 and in 2019, the in-hospital all-cause mortality rate for patients with heart failure was 8.6%.
Readmission rates of more than 20% in 30 days, average $5,000 a patient spend on diagnosis and treatment. In reality, not all regions of Canada have a specialized heart failure center, so that patient often has several appointments with multiple providers across multiple settings. In addition, Canada has a universal health coverage system in which provinces and territories may provide limited emergency service, but not all life-saving treatments to patients.
Lastly, we are going to summarize all of this data. America was inferior in categories such as cost, averaging over 4 times more per patient than Canada did. However, they were superior in categories such as mortality rate, which some may say outweigh the disadvantage of cost. Because of these differences, some may say that one healthcare system is better than the other. But that is only looking at specific statistics, not overall. Overall, they both have disadvantages and they have advantages. And so it's up to the individual to decide which healthcare system is better.